If a child goes and hides under the bed, okay, and let's say a favorite uncle has visited and the child is going under the bed and just basically hiding, you have to ask yourself, what is going on? So children communicate through behaviors. They're trying to tell you something, and that's very important to keep in mind. Now, there's obviously so much to understanding personality development, childhood adjustment, etc. So I can't go into all of that, but I wanted to set the stage for understanding a couple of things. One is children communicate through behaviors, and two is behaviors are repetitive. So when you have repetitive behaviors, you cannot tell a child, stop doing it, it'll get you into trouble. You have to understand what the child is doing and why they're doing what they're doing and what it is that they're trying to communicate. And that is the goal of therapy. And that's where one has to get into understanding what has gone on in the child's life, that a particular behavior has emerged in this way. And that's one of the things that we go in-depth psychotherapy is trying to put it together, reconstructing something so that we can try to make sense. This Tuesday, in fact, I'm going to be working with Udayan, the social workers there, the staff, and I'm going to be teaching them the art of really having a child, especially in institutionalized children, this is a very important piece of their work, is how to help them develop a narrative on their life. Okay? Now, why is that important? And I'll get into it, because attachment is part of that. Because children in institutions come from severely traumatized backgrounds, by and large. One of the things that I found out in my work with Udayan, ongoing work, is, and I think that is true of all institutions, perhaps in all different countries, besides poverty. And poverty brings its own challenges, because it's not just one thing or the other. You have poverty, you have loss of parents, you have traumatizing situations, etc. So there are many things that are put together, right? That you would agree that these children have situations that they come from that impact how they relate and how they will adjust to and what they will do in life later on, right? So it has an impact. So all these things are part of that when they come to a particular setting that they're bringing with them. So they're coming in with a history that, because I'm an analyst, I'm going to use a word called repression. Right? Now, what do analysts do? In analysts, we think about behavior as coming from conscious thought, and then we have behaviors that are unconscious. We do things, but we don't know why we're doing things. Right? Children, traumatized children, like all of us, it's good to forget certain things. Right? Children need to forget certain things because it's the adapted thing to do. Because otherwise they would go crazy. Right? But that doesn't mean that the body doesn't remember. The body remembers, and it comes out during adolescence, it comes out in behaviors during different ages, it comes out when they are promiscuous in adolescence, it comes out when they're trying to run away repeatedly from a home. They're trying to convey something. The body remembers. It's called implicit memory. It's coded in our minds in neurological ways, okay, so in neurons. So that is a very important part of our thing. Now I'm going to talk about, I can't go into all of that. I know Dr. Achal Bhagat will give a fine presentation on trauma, so I don't want to get into that. I'm going to talk about just attachment and how significant that is in setting the stage for how children become adults, young adults and adults that can relate to someone, and how this is a problem in institutional settings and why it's a problem and what we can do with it. Okay? But I wanted to give you a sort of set the stage.